One of the major dividing things that I'm seeing that's associated with the COVID-19 situation is the conversation about healthcare versus liberties and freedoms. I just want to give my opinion on this, and hopefully this will shed some light and help differentiate the two. I look at four main risk factors associated with patients that are being affected by this virus and be bluntly affected by any virus, bacteria, respiratory viruses, flus, whatever, and that is diabetes, hypertension, obesity, and lung disease. Over my medical career between Louisiana, Arkansas, South Carolina, Virginia, Kentucky, and other places, I have treated well over hundreds of thousands of patients in those states, including West Virginia, including Mississippi, Alabama, Texas, all the states obviously close by during my training and my medical career. And of those hundreds and thousands of patients that I have treated with those four disease processes, I can tell you that the overwhelming vast majority of patients that have uncontrolled diabetes, uncontrolled hypertension, bad obesity, and bad lung disease, all of those patients have those issues because of poor life choices that they've made through the disease process. They understood what they were doing. As their doctor and myself and many other doctors, we've educated them many times, to avoid smoking, exercise, eat better, so forth. But despite those things, they made conscious decisions to make poor lifestyle choices that led to poor health consequences. I want to be very clear. I don't have an issue with people making conscious decisions, understanding the negative consequences that come with them. That is their right as Americans. That is the freedoms that my grandfather and many other Americans fought for them to have. All that being said, when those poor choices lead to poor outcomes, when a virus comes, when a bacteria comes, when they have bad weather, when anything happens, those of us who did not make those choices should not lose our freedoms because of them. And I think COVID-19 is a great example of that. Is this virus real? Yes, it's real. The flu's real. Yellow fever was real. All these viruses are very real. But when you look at the data, it is very clear that people that are most affected are people that have made a significant amount of poor lifestyle choices their entire lives. This is not a virus that 99% of Americans need to be scared of. This is a virus that people that are extremely sick and extremely unhealthy need to be concerned about, just like they need to be concerned about many other viruses and other disease processes because of their poor life choices. The thing that makes it even more concerning is when you look at the freedoms that majority of Americans have lost, that our quote unquote medical leadership has done. They don't even understand what they're doing. First they tell us to wear a mask, now they're telling us not to wear a mask. First they're telling us our hospital is going to be overrun by this pandemic, and then they're saying, well, maybe we're wrong, the numbers were escalated. Now we're seeing that the deaths are being skewed. I want to make it very clear as a physician, when you're looking at patients with uncontrolled diabetes, obesity, hypertension, these people die every day. These people die of bed sores. These people die of pneumonia. It is so easy to skew a number and say that this patient died of X because they have so many disease processes. It's hard to pick one that actually led to their death. Let's be very clear. If someone dies of emphysema from cigarettes, they didn't die of emphysema. They died of cigarette smoking. They didn't die of COVID-19. They died of cigarette smoking. They didn't die of COVID-19 because of uncontrolled diabetes. They died because they made extremely poor health choices their entire lives that led to that situation, not because of a single virus. We know what 40% unemployment is going to do. We have history. We understand the economic impact, jobs lost, suicide, all the negative things that are being done. I just absolutely don't understand the freedoms that are being taken away from us and what is being done to our children at the expense of fighting something that many Americans have made conscious decisions that have led to this situation. And again, when I look at the medical leadership and I look at the absolute inconsistent data that has been given from the get-go from this and how wrong they've been on basically every merit to pay this heavy of a price and for majority of Americans to lose this many freedoms this fast, I can't reconcile it as a physician or as an American citizen.